Thank you.
Okay.
Hello, everybody. Thank you very much for the kind introduction. I am not sure that I genuinely deserve it, but it is a pleasure to try and summarize today's presentations, although I have to say I think it is one that is beyond me. We have covered so much content and had such fruitful discussion. I think we started the day really well with that tripartite presentation that explained how deeply we as a species have impacted the geological and ecological sphere of the planet. So much so that we've taken on the title of a geological process. And that is, you know, when you stop and think about it, absolutely horrifying. That 1/3 of the fossil record will be us, and pretty much all the rest of it will be the animals that we eat and live with. The problem I think that we faced is that in the West, and we talked about the fact that this is a Western white rich person's problem, we caused the problem, is that we have become disconnected from nature, and even more than that, we purposefully passed laws which have disconnected other people from their place in nature and the environment. And that has led to, you know, a global disconnect from understanding that we exist as part of the system, not above it. And we can think about the dominant theology in Western European culture. We were told that we had dominion over the plants and animals and the earth, and we definitely acted like that. We did not act as responsible members of a system or custodians of that. And when Trevor pointed out that we are now consuming more natural resources than the planet has, that should be a clear signal to everybody that we have to just stop doing that. Unfortunately, we are not the only voices here. And what I heard, I really enjoyed the discussion, but what the discussions that I've heard today screamed at me was social media bubble. Everybody in this room believes the same things. We believe that racism is a fundamental determinant of inequity in health. We believe that racism is a fundamental determinant of ecological inequity. We believe that we have to have a balance of human, animal, and environmental health in order to have a sustainable future on the planet. But other people don't believe that. There is a shocking percentage of Canadians, and I think Canadians are reasonably well balanced, who don't genuinely believe that climate change is based on human activity. And when we have these discussions, we need to think very carefully about how we bring people along on the journey with us. And that's compounded when we think about actual policymakers. Many of us write policy, many of us write policy position papers and try and change policy, but we're not policymakers on the whole. Politicians have shown tremendous willingness to use climate change and the action that the federal government took, for example, against climate change, to try and win elections in the last cycle. And it worked. In Manitoba, Saskatchewan, and Alberta, that was a very successful strategy. So we have very difficult arguments to make, both up to the people who can actually make policy changes and out to the people who need those policy changes in place and engaging with them. And unfortunately for public health, and I've said this before and I will say it again, we have a tendency, because of the way we are trained, to rely on data. We will show you all of the lovely graphs, all of the squiggles, all of the things which show you how precipitously bad the situation is, but people don't want that. It doesn't form a connection with people who are not as data-driven and trained in the same way as us. They need authentic, engaging stories. You know, And we have struggled consistently to do that. But until we can engage with the public and tell them those engaging stories, we are going to struggle changing politicians' minds, because they don't care what we think. Their jobs aren't dependent on what we think, they're dependent on what the public think. And when the public believes that this is important, politicians will suddenly believe that this is important. And make no mistake, the Black Lives Matter movement has suddenly become a mainstream activity across the globe, because the death of George Floyd in front of us on TV was a compelling and engaging story. That is what did it. And the pandemic, there's been a lot of talk today around the pandemic, and I've spent quite a lot of time over the last 12 weeks looking not in Canada but outside, and I have to tell you, there's a bit of a bubble there, right? We talk about how well we've dealt with the pandemic, and we talk about how well we've dealt with the pandemic in BC, and all of that is true. Bonnie Henry has been good. The federal government here has been good. All of the provincial governments have actually performed very well, including provincial governments that we probably didn't expect to perform well. But globally, that is not true. 12 days ago, we passed 10 million cases. Today, we passed 12 million cases. That's a horrifying statistic. And we all know, because we're in public health, that these are dramatic underestimates of the actual number of cases, and that we really don't have a very good idea about globally how many people have died of this. So we need to think very carefully about how, what lessons the pandemic actually tells us, right? Canada has done a good job. Is that lesson applicable to future problems? Bear in mind, we didn't prevent this pandemic. It happened. It hit us, and it hit us pretty hard. And a lot of people have got sick and died in Canada. And it's not that this pandemic wasn't foreseeable. It was entirely foreseeable. Then exercise was run, tabletop exercise at a senior level was run in the US, specifically on a coronavirus pandemic in October last year. We just failed to prepare for it. We prepared to explain to politicians and to the public that this was a threat, and so it caught them by surprise. Climate change impact is entirely foreseeable. We've got incredibly good models to tell us what's going to happen, but we're still not actually preparing for it in a meaningful way, not across the board. And so how do we learn the important lesson from this pandemic, which is not how you communicate and manage the disaster when it's landed on your lap, but what do you do to prevent that disaster from happening? How do you move people? And the challenge with the pandemic, of course, the easy bit about the pandemic is we're watching people get sick and dying. We're still 4, 5, 6, 7 years away from the real impacts of climate change. And let's be honest, they're not going to hit the smug white people living in a higher income country first. They're going to hit other people. And as we've already said, there is a systemic racism that runs all the way through our society, which means we don't care much about that as a society. We care about us. And that is another challenge which we have to sort of deal with. And I feel like I'm being a bit of a Debbie Downer, because I'm being a bit of a Debbie Downer. But we also, as we go into tomorrow's session where we talk about what it is that we are going to do locally to change this situation, we have to think about the obstacles which are in the way of what we know is a manifest truth. Like, none of us have any doubt that this is true. And I did a quick statistical sort of like bit of jiggery pokery just to convince somebody once. And you have a greater chance of surviving a gunshot wound to the chest than avoiding the consequences of climate change if we do nothing. No one is going to stand up and volunteer for that trial, right? No one's going to say, okay, well, let's see what my likelihood of being shot in the chest and surviving is. But everybody is willing to bet on not suffering the consequences of climate change. And we need to communicate that this is not a possibility, it is an inevitability, that it will hurt you and your children. And that theme that came at the beginning of the day, but I think has run all the way through it, of this is an issue of equity, not just racial and financial and social equity, but intergenerational equity, that we are now knowingly stealing the future of our children and our grandchildren and our great-grandchildren. And our grandparents had the excuse that they didn't know that. But we are out of that excuse, and we need to work with people so that they understand it and that they start preserving that future. Because when you put it in that way, people will come together. Most people were not going to die of COVID-19. Most people were going to get sick and be really unhappy, but we protected the health system and the lives of older people. We are willing as a society to make some sacrifices, but we really need to be, that really needs to be clear to us, and it's down to us to communicate and to tailor those messages. And I really love the work on the complex systems and the tipping point. And, you know, if this ball is sort of balanced at the top of that peak, we need to make sure it goes the right way, because we've already seen in the last 4 years, Donald Trump being elected in the US, Bolsonaro in Brazil, we've got Boris Johnson in the UK, and we know how that plays out as far as public health is concerned. We've seen it real time over the last 12 weeks, that those people and that type of society can't deal with these challenges, and we need to do better than that. So we need to be nudging this ball to collective action rather than nationalism and, you know, I'm right, Jack, pull the ladder up. I'm really looking forward to tomorrow. Hopefully that doesn't make you all go home and have mental health issues tonight. But because I really think that this is a tremendous group of people who've come together to do good, but we need to focus on what we can do practically to really change things at the local level and have that global impact eventually. Thank you very much.
Thank you so much, Stephen. And I'm just thinking it makes sense to end the day with the 3.5% that Tim Tuccaro mentioned as the percentage of folks who can be successful in creating radical shift. The shift is upon us in so many ways right now. And I do want to thank all of the folks who contributed as volunteers today, the folks that took notes, the folks that engaged in chat, the folks that found their voice in topics near and dear and new topics. This is an exploration from a wide range of perspectives. Stephen, that was a brilliant summary, and thank you so much for positioning us for tomorrow's discourse. And I just want to say thank you to all of you who have been able to stay in your chairs attending to a virtual conversation. It's been a very successful day, and we're really excited about tomorrow. And I would just turn to Maya and Trevor to see if you have any closing comments for day one.
Thank you, Shannon. I just would like to echo the appreciation, and I have a sense that the information is concentrating and intensifying, and we're going to percolate through the night and maybe have wild dreams and maybe careen along the edge of some mental health challenges, but then we're going to come back. And I really look forward to tomorrow and to our focus on action and to engaging with those tough questions that we've all been proposing we need to deal with today, and Stephen has summarized for us as well. So thank you.
And what she said.
And take care of yourselves tonight. This is a lot to hold, and this work is heavy work, and it does bring a lot up. So just be gentle and give and take care.
Go and have a beer.